Hey guys, Natalia here from Live Birth Health Center, and today I'll be doing a video about your second trimester, the things that you'll be going through, body changes, and some exercises that may help you through this specific trimester. So the second trimester represents the middle part of your pregnancy, so between 13 to 26 weeks. The best part of this trimester, and fingers crossed, is that the nausea stops or settles down at least. During these 3 months, your baby's organs will continue to develop as the liver, pancreas, and kidneys all start to function. Now your body will undergo major changes. Your uterus will grow. You may feel some type of discomfort or aches as the uterine ligaments stretch. So in particularly, some women do get that round ligament pain at the front of the belly, and this is what's stretching, what's growing. And you will also feel some skin stretching around the belly, and your breasts will start to feel quite tender and sore. You will also notice some skin changes, and this is because of hormonal changes during pregnancy, which stimulate an increase in pigment-bearing cells. And as a result, you may develop some dark circles around your face or around your body. These are very, very common throughout pregnancy, and they will generally fade after delivery. You will also start noticing some red, brownish blemishes, black, silver, or purple lines, also known as stretch marks. And you'll notice them around your abdomen, your breast, your buttocks, and your thighs. And again, this is very, very common throughout your pregnancy journey. It does come down to genetics. Stretch marks unfortunately aren't preventative, but they are manageable. You will also notice some leg cramping, especially during the night. As the pregnancy progresses, to prevent this, you'll just need to stretch out that particular muscle, and obviously treatment as well would definitely help with that. Now, some women do get an increase of vaginal discharge. You may notice that it might be sticky, clear, white vaginal discharge, but this is all completely normal. So keep in mind that it is normal and it's not abnormal at all. You need to contact your midwife or your GP if it becomes to smell. It becomes really, really strong in odor, unusual color, or it is accompanied by pain or itchiness in that particular vaginal area. This may just indicate that you might just have a vaginal infection, but again, just speak to them so that you can get the all clear from there. Now the fun stuff. Approximately from week 19, you may start to feel some movement, such as faint kicking, tickling, or even fluttering butterflies. Also, this is the time where you might notice in your ultrasounds that where the baby starts to suck their thumb. By week 20, your baby can hear and detect sounds. So they're able to hear your heartbeat, or if anyone's talking around your belly, they'll be able to notice some voice. Now we'll be moving on to some exercises. So the first one, you obviously do it at the comfort of your home, and again, if however big you are, depending on some exercises and comfortability as well, it just depends on how big your belly is and how low I suppose you can get to those exercises. So the first one, I'm just going to change the camera to this section. The first one will be stretching out your glutes. Now, again, you can do this seated, but depending on the belly or the size of your belly, you might not be able to do that. So I prefer giving it standard. So the first one is bringing your leg up like this, and then you kneel forward, and you should feel a stretch in your glutes. Now, this isn't the correct form. I definitely need something higher. So you can use a desk, a high table, just to get that stretch in your buttock. And obviously do it on the opposite side. With these stretches, you at least want to hold it for 15 to 30 seconds to fully engage that muscle to stretch. Now, another exercise to stretch out your back, because obviously in pregnancy you get lots of back aches. having a chair like so, and again, leaning on a desk at an appropriate height. And you're having your legs out like this. Again, depending on your belly, you might be more wide in your legs or a little bit narrow. And you literally lean forward. And come back up and lean forward. And you really start to feel the stretch through there. Now we'll be using the exercise ball. Sorry guys. So, some women tend to get some pain and discomfort in their hips and their lower back. The exercise ball is a great tool to have throughout your pregnancy, because any exercise that you can't do on the floor, you can definitely do on the ball. So one is doing some pelvic tilts on the ball. So I'm just going to turn to the side. Now with here, you're literally tilting that pelvis forward and back, forward and back. So imagining that pubic bone, you're shining it forward, and then you're tilting that pelvic bone backwards, shining that forward and backwards, forwards and backwards. These exercises are good to do while you're watching TV. So you're doing something that you like, but also doing some exercises. Another one is to do some hip rotations, purely because your ligaments start to stretch and get a little bit sore. So you're just hula hooping like that. That allows your hips to open up a little bit. And just be very careful, try not to fall. And then you can go the opposite way. Another one is giving yourself a cuddle, and again, rotating to one side and then rotating to the other side. This would just help increase your range of motion in your upper back and a bit of your lower back as well. And now we're going to reach for the side. So you can either have your hand on your hip or on your leg and reach. Imagine this hand is shooting out stars on the opposite side. Try not to collapse like that. Try to imagine there's a barbed wire fence and you're reaching over that side, and then the same on the other side. Now the famous child's pose exercise. Again, when you have a bigger belly, your stance is a little bit wider. What I mean by wide, you're probably in that position and you've got the ball to guide you. So you roll the ball forward and then you'll feel that stretch along your back. And then you can go even wider, whatever's comfortable for you. The beauty of this, then you can deviate to either side, so adding that rotation. And then the opposite side. And like I've said, with those stretches, you want to at least hold it for 15 seconds to really feel that stretch. Overall, these exercises are just for you to help throughout your second trimester. It's more encouraging that mobility through your upper back and your lower back and stretching those particular muscles that tense up during your pregnancy. One thing that I want to make notice is that education is very, very important throughout pregnancy, regardless if it's your first, second or third. So definitely speak to your midwife or the GP if you've got any pamphlets regarding any classes, such as prenatal classes or breastfeeding classes. And ensure that you and your partner attend these classes together, because you'll find that other people are going through the same thing as you and that you will experience the same journey. Take care, guys.